If we look at the research into safety culture and behavior, and psychologists, industrial psychologists spend quite a lot of time trying to measure this by using questionnaires and other techniques, the indications are we can have a culture that supports safe behaviors. So where we get strong measurements of safety culture in a work site, these are usually industrial sites, but there's studies coming through in healthcare, the accident rates, these are for workers, tend to be lower. Workers who think that their supervisors or their managers are more committed to safety or prioritizing safety then report engaging in more safety-related behaviors and fewer risk-taking. So we see from these self-report studies these links. And what we need to understand is what is the linkage between culture and behavior? And the linkage lies in the heads of the workers. It lies in what do you think you're going to get rewarded for? What's going to motivate you? How do you think your boss, how do you think other people are going to respond? Because that's really what then drives or influences your behavior. And we heard a little bit about this last year, for those of you who were at the meeting, from Amy Edmondson, who talked about this concept of psychological safety. That's a culture where you feel safe enough to speak up or safe enough to report incidents, and that being something, again, to do with leader behavior, enabling you to do this. And so we can put all these things, in a sense, into this sort of model that we can test. We can look at organizational factors like the safety culture, like the leadership. We can look at the behaviors, like people complying with rules or people risk-taking, and then the consequences of that. But the piece I've highlighted in the middle here is the piece I think that's interesting, and a piece you maybe can begin to get into in simulation work, is what are the values, what are the motivations, what are the people's expectations as you do debriefing when you've looked at behavior. Sometimes you can begin to tap into some understanding of what people are thinking about when they're making decisions about behaving one way or another. And these start to give us, as it were, causal pathways to safety. So if we start to look at what are the behaviors, and you're obviously, many of you, watching behavior in your simulators, you're writing scenarios to produce certain kinds of behavior you want to create, you want to comment on. The kinds of key, what we might call safety behaviors, are things to do with, these are the things that will be measured very much in the safety studies and industry. People complying with procedures, complying with the rules, taking risks or taking steps to avoid them, reporting incidents I'll speak about in a minute, people challenging, speaking up, people trying to whistleblow, people getting involved. And much of this is to do with whether managers and supervisors are demonstrating. It's not enough as a manager or supervisor to have values about safety. You have to demonstrate these to other people, to the group. And these are things, these are behavior patterns that you may be able to see if you look for them when you're running simulations. If I take just one of these as an example, the example of, and I don't know how well people can read this, but this is just stepping through a situation when we want to think about people reporting incidents. What happens in your organization when you've made a mistake? Do you take ownership of the problem, immediately assess the consequences? Are the consequences serious? If they're not, well, you might just take corrective action, investigate why the mistake occurred, look whether there's any flaws. If there's not, then just try to learn from your mistake. And in that case, you've dealt with the problem. You've done all the right things here. If the consequences are more serious, then you maybe want to immediately tell somebody more senior about your mistake, cooperate to deal with this, correct the problem, review procedures. If there's flaws in the system, indeed, you want to share that. You want to tell people about the mistake. You want to help them discover, improve processes. And we put all this together in this climate of psychological safety where people are comfortable speaking up. And this is really what a learning organization would be like. It's the kind of thing that would go on in that culture. So just take a second example. You've again made a mistake. First of all, your question is now, will it show? No, it won't show. then maybe I'll just bury it. I've put that in inverted commas because that's not, this slide wasn't designed for a healthcare audience. At which point, having buried it, the problem is now avoided. Will it show yes? Can you hide it? No. Can you blame somebody else? Or special circumstances? No. Could admission damage your career prospects? Yes. Sit tight and hope the problem goes away. Still, you haven't told anybody about this particular event. Is it going to show, can you hide it? Yes, you can hide it. Conceal it before anyone else finds out. Can you blame somebody else? Yes, you can. So get in first with your version of the events. Altogether, this is a very different culture in this organization, a very different set of behaviors here, which we might call the sweep it under the carpet organization. So two kind of little models here of one particular behavior and a whole set of associated motivations and expectations, and whether there's a sense of psychological safety here, I think, is apparent in the two contrasting examples. And this is the kind of thing we have to get into when we're looking at the reality of what our organizations are like. This is where we're lacking the data. It's all the day-to-day stuff like this that we're needing to understand better. The other set of behaviours and this is work we've been looking at with colleagues in Scotland, is what are called non-technical skills, a label that generates a little bit of debate, which I won't go into here. This is a term that's come from European civil aviation in the early 1990s, where, and you might know these as crew resource management skills, but these are the cognitive and social skills of pilots on the flight deck that the aviation industry realized about 20 to 30 years ago, that when there were failures in these behaviors or these skills, the likelihood of accidents was increased. And they made strenuous efforts in aviation to address this by designing special training in crew resource management, non-technical skills, and then also beginning to check not just pilots' technical skills, but checking whether the non-technical skills that they were training were also transferring to the flight deck. And I was involved in the project in Europe, which came up with a behavioral marker system called Nontechnical that was designed for airlines to be able to make ratings of these non-technical skills as well as the technical skills. And I think we have to look at these behaviors as well. It's all very well looking at the safety behaviors like speaking up and reporting incidents, but what's really important is looking at the day-to-day normal behaviors that people engage in when they're just doing their normal tasks. I think that's really where we have to start looking at the culture as well. I won't go through all this, but why focus on these non-technical skills? There's building evidence in healthcare, well documented now, that when these skills are present, good decision-making, strong leadership, effective teamwork, the likelihood of error goes down. If the likelihood of error goes down, the likelihood of an adverse event for your patient will go down as well. And so the work we've been doing in Aberdeen and with the Clinical Simulation Centre in Stirling has resulted in a number of these non-technical skills systems that are really looking at not just safety-specific behaviours, but looking at routine task behaviours. And we have a number of these taxonomies and marker systems, and they're on the web. You can download them or contact somebody and be sent these marker systems. So we've got 3 of these. One is for anaesthetists, anesthesiologists. One is for surgeons. It's called NOTS. And the new system that Lucy Mitchell, who's here with Jan Mitchell to do a workshop tomorrow, is called SPLINTS, and that's for scrub nurses, scrub practitioners. So now we've got a suite of these tools for measuring some key members of the operating theatre team, and there's some other people working on other tools for other team members. And this is because we think looking at individual behaviour is very important. It is important to look at multidisciplinary teams and teamwork, but we have to look at people's individual skills as well. And this is the kind of, I'll not go through all this, but this is the sort of skill set we have for the surgeons: situation awareness, decision making, teamwork, leadership. Those kind of behaviours are important. Now, many of you, I was at a workshop yesterday in IMSH, run by colleagues from Scotland, and many people who were there talked about, oh, we've been training technical skills and now we want to start looking more at the non-technical skills alongside that. And so this is what this kind of system is developed for. But there's some interesting linkage here, I think, if we start looking at the non-technical skills systems and culture. Because you can spend a lot of time and effort in your sim centre training these good behaviours for safety and discouraging less effective behaviours. But the question is, what happens when the people who've been in the training course go back into their workplace, go back into the unit? Are they, coming from the sweep it under the carpet kind of school of management, or are they coming from a different sort of culture? So the setting of the unit culture around those behaviours is something I think is very important to start thinking about if you're in a sim centre and starting to try and change those behaviours. There's a very nice study by some researchers in England, Peter McCulloch and colleagues, who were running a training study looking at a programme of training CRM skills, non-technical skills, for British operating theatre teams. And what was nice about their study was that they didn't just deliver some training and then walk away. They stayed for a few months and made visits into the workplace to see if the skills were maintained. And then they stopped going into the workplace, but they continued to make some measurements. And what was very interesting in this paper was that they found some cultural resistance to adopting these non-technical skills when they looked at it in the workplace, particularly among medical staff. And one of the people in this group, Tony Giddings, made a nice comment, I thought an interesting comment, about these good behaviours that were being taught and people were learning and people were practicing in the training and the simulation, but then were extinguishing as time went by. And he said, oh, well, it's just as if mummy and daddy have gone out. So the behaviours were all very nice when people were being observed. And as we heard in an earlier slide, this thing about behaving when nobody is watching is possibly the key. So this thought about how is the culture going to affect the behaviours that you're training. Now, you may or may not have control over that, but it maybe is something to think about when you're training these kind of skills.